Hi there. Just finished a long day at the office and I came home. It's about 7:30 and I'm outside where the day is starting to cool off. The temperature's probably still close to 80 degrees, but definitely the humidity has dropped and it's feeling a little better out here. So I've got a bunch of spaniels out in the yard with me and they're running around and you'll hear them panting. And based on today's post, I wanted to do a little video on heat stroke and hyperthermia because there were some questions how to recognize it and how to treat it. And this is a very, very serious condition and definitely can cause problems in any dog, but certain breeds are going to be more prone to problems. So if you own a dog who is overweight, who is a short-nosed breed. So the pugs, the Boston Terriers, most of the Cavalier King Charles Spaniels, the English Toy Spaniels, anybody who's got kind of the pushed-in face. And for cats, that would be those Persians and those guys with the little smushy faces. We don't see it as often in cats because they're usually inside, particularly those hybrid breeds. But if they were outside, this would definitely be something to consider with them as well. So if your dog has a heart condition, has an underactive thyroid, has any kind of compromise to their airway, hi Scout, any kind of compromise to their airway, then they would be dogs that would be more prone to problems. So what are we going to see in a pet who's having a problem? Sometimes it can really sneak up on you. So if you have your pet out for a walk, and even if you think that it's not that hot or that humid out, remember that they've got on their full coat. Even if you clip them down, they've still got a lot more hair and a lot more padding than a lot of us do. So consider how you would feel if you were wearing even a light jacket if it's a hot, humid day. So they're going to be more susceptible to the heat problems. So if your dog is lagging on the walk or doesn't really want to go on the walk, then pay attention to those signs that they're giving you. If they're panting heavily, if the tongue is hanging out, if the eyes are getting red, if the tongue or the gums or the mucous membranes are looking a little darker red, if they're panting heavily, if there's any extra noise in the breathing, pay attention to those symptoms. Stop, pick them up, don't make them walk the rest of the way home. If it's a big dog and you can't pick them up, get them to a shady spot. Allow them to lie down. Try to find something to cool them with. If you're half a mile from home and you've got a cell phone with you, call home and get somebody to come pick up the dog. So once you've decided that maybe your dog's a little bit overheated, if you have a rectal thermometer, you can certainly take their temperature. If you cannot take their temperature and you suspect that they're overheating, things that you can do if you have them available would be to apply alcohol to the foot pads, to the inside of the ears, to the inside of the groin. Those are areas where the alcohol is going to help cool the body. You can apply lukewarm to slightly cool water to the head, to the body, to the groin, to the legs. You do not want to apply ice or ice packs because that's actually going to shut down the circulation, and that's not something that we want to do. We want to cool them gradually. Anything over 104 degrees as a body temperature, we can start having organ damage. So we want to cool them, and you want to be monitoring that temperature if at all possible. Once the body temperature reaches about 103 degrees, you want to stop the cooling process because they're going to continue to cool on their own. Make sure you have them in air conditioning. Something like moist towels are a good thing to lay them on, to wrap them in. Once the body temperature starts to come down, if you've been doing all this at home, you should get them to a veterinarian. A lot of times they need IV fluids to help cool their body. They may need to maintain on IV fluids, and organs can shut down when we've had an heat exhaustion or a heat stroke in these dogs. So we need to watch kidney function, we need to watch the heart, and we need to watch for any clotting or bleeding problems. So over the next few days after a heat stroke occurs, check the stools. Look for bloody, tarry, jelly-like stools. That's an indication that we've had damage to the bowel. The heat is going to kill the most rapidly dividing cells of the body, and those are the cells that line the intestines. Certainly the kidneys can have trouble, the liver can have trouble, and the heart can have trouble. So make sure you have them checked by your veterinarian. Watch them very closely. If there's any thought at all that maybe there was damage, then get the lab work done, get the fluids on board, and watch them closely. Things to watch for would be any bruising areas or little red spots on the skin. Those would be indications that there's areas of hemorrhage. When we get high heat to the body, we can have swelling of the brain. So the dogs can appear drunk. They can walk unsteadily. They can, kind of be falling off their feet. Those are symptoms that we've had brain swelling and we've got some damage going on. Needs to be treated really aggressively, and that's an animal that needs to be under veterinary care, preferably in a 24-hour facility where someone can watch them. Hopefully this helps you a little bit so that you know what to watch for. Be very, very careful in the summer. If you take your dogs out to exercise, please do it early in the morning, late in the evening, when the humidity is not as bad, when the temperature has dropped. If you have these short-nosed breeds or a dog who's overweight, has laryngeal paralysis, hypothyroidism, collapsing trachea, asthma, chronic bronchitis, heart disease, any of those things, please exercise them very, very carefully in the summer, if at all. Try to do things in the house instead where we can keep them in air conditioning, watch them very closely. So hopefully that's a little bit of help, and enjoy your summer safely. Thanks.